Welcome to Rumor Has It, the podcast that busts myths, highlights evidence, and inspires hope for living better with rheumatic diseases.
Through our plain language interviews with experts, we offer actionable knowledge so you can thrive today.
My name is Eileen.
And my name is Cheryl,
Join us as we bust myths.
and Spotlight Evidence.
Now, today I'm very excited to introduce rheumatologist Dr. Glenn Hazelwood. And I've been privileged to have had the opportunity to have been involved with some projects with Dr. Hazelwood and have seen him speak as he is a researcher with Arthritis Research Canada and being on the patient advisory board. I'm very lucky to get to be exposed to fantastic rheumatologists and researchers like him. Now, I will get him to explain his role, his how he got involved in rheumatology, and a little bit about himself and the work he does. Can you tell us about yourself, Dr. Hazelwood?
Yeah, absolutely. And thank you both for inviting me today. So, I'm a rheumatologist in Calgary, did my medical training, residency all in Calgary, went to Toronto after my clinical training to do a research degree, my PhD in research methods, clinical research methods. And then I've been back in Calgary since 2012 and work as a researcher here. I see patients with all sorts of rheumatic diseases, both in the hospital and in clinic. A lot of the research I do is focused in rheumatoid arthritis and focuses on a few things. One is guidelines. So I lead the Canadian guidelines for rheumatoid arthritis, very involved with those. Different research on medication effectiveness and safety, patient preferences, and how do we sort of capture the patient in our guidelines and in treatment decisions we make. So thanks again for having me.
We're so happy to have you, and you're just talking right up our alley because today's topic is busting myths about medications. And for me, as somebody who has been highly medicated for rheumatoid arthritis for 22 years, and which has enabled me to function, dance and swim and run around with my son. And I'm so grateful to these medications. But as somebody also active on social media, I see a lot of misinformation or fear mongering about them. So we're really happy to have you here today to help bust some myths and also address, yes, there are potential side effects, but also helping patients kind of weigh those against the potential benefits of the medications. So I'll turn it over to Eileen to introduce our first myth to bust.
Yeah, and medications, I think when we both live with rheumatoid arthritis, I think there is a very complex need for them. The connection to medications and my diagnosis of rheumatoid arthritis is I'm considered severe. I've had many medications fail me, but also my aunt was diagnosed with rheumatoid arthritis like 40 years prior to my diagnosis, and I always knew of rheumatoid arthritis because she was in a wheelchair and she couldn't really walk. Her hands were severely deformed and she suffered, obesity from steroids. She was treated with gold and she was diagnosed before the time of biologics. So, having seen the advances in medication and also the devastating effects that rheumatoid arthritis can have when left untreated, and also feeling those effects when you have uncontrolled rheumatoid arthritis, I think medications is an incredibly important topic because there's a lot of misinformation and myths, and I think the what first myth that we need to bust, because if you go into any Facebook group or on social media, there's always talk about rheumatic disease medications are dangerous and have extreme side effects. What would you say to somebody who believes that?
Yeah, so I have these conversations all the time with patients, and I think what you are seeing in social media is what I hear in my clinic a lot. I think and you both touched on a really key, I think, point for people to consider when they're having discussions about medications is the disease itself can be dangerous and have side effects and have complications. So, rheumatoid arthritis, for example, or the other types of autoimmune arthritis, one, they affect the joints. They cause joint swelling, inflammation, pain, loss of function. They also cause inflammation throughout the body as well. And we know very well the effects they have on fatigue, which is really common in people with active rheumatoid arthritis and other rheumatic diseases. We know that people with, you know, poorly controlled rheumatoid arthritis have higher rates of heart disease, have higher rates of blood clots. There's all sorts of you know, adverse health effects that you have if you have untreated rheumatic diseases, rheumatoid arthritis, or any of the other rheumatic diseases. So I think that's one thing to consider. The other thing is, yes, I think it's important to acknowledge, any medication can have side effects, right? I tend to lump medication side effects into rare adverse events that can happen. These are things like, you know, some medications can cause low blood counts rarely, or you can get, allergic reactions to them, or rarely they can have issues with the liver. These are what I call adverse events, which is kind of unexpected, rare things that can happen really with any medication, right? We're very careful in rheumatology to monitor for those. That might mean regular blood counts, checking in with the patient, with visits. One of the medications we use, hydroxychloroquine, you get your eyes examined once a year. So we're those the chance of having one of those is uncommon, and we can reduce that risk as much as possible through monitoring. The other kind of group of adverse effects are what I call side effects, which is things you might feel when you take the medication. These can be, you know, upset stomach, fatigue, different, you take the medication and you feel a side effect in some way. And almost always we have ways of dealing with those, whether it's lowering the dose of the medication, taking the medication a different way, if it's too much, switching to a different medication as well. So yes, every medication has side effects. So do rheumatic disease medications. They're very safe. We've used them long term in hundreds of thousands of patients with most of the medications, and we're very good at minimizing any potential side effects or adverse events from them.
That's really, really helpful. Thank you. That's exactly what I remember my rheumatologist saying when I first started the medication. The second myth I would love your opinion on is this one really gets me. When people say, oh, these medications only mask the symptoms and don't address the disease itself or don't address the root cause.
Yeah, exactly. So I that is a definite misconception or myth, because even in the name of the medications, we call them disease modifying anti-rheumatic drugs. So they modify the disease. It's in the name. And how they do that is when you have an autoimmune disease, there's different, the immune system is incredibly complex, and there's a lot of different cells and proteins and you know cells and protein signaling cytokines. All of these things are active and can be active in different ways and for different diseases, and the medications target those different pathways to shut down that inflammation. So I think sometimes people, because we don't cure the disease, think of it as complete cure, as in you never have the disease anymore and it's gone. The medications don't do that, but they treat the processes that are driving the inflammation that's causing, whether it's the joints or lots of our diseases affect other organs throughout the body. They absolutely affect those pathways to shut, to stop the body from reacting against the joints or whatever tissues.
Thank you for walking us through that. That was very well explained. And yeah, I do find that the medications really do kind of explain what they do in the name. I like that you brought that up. We're moving on to now stigmas to challenge about the medications involved for rheumatic diseases. Now, what would you say to somebody who says that using advanced treatments like biologics means that your disease is severe?
If you have ever felt completely lost or utterly alone while trying to navigate real life with rheumatic disease, listen up. I am here for you. I created an educational program to help you go from overwhelmed to confident, supported, and connected in a matter of weeks, and it's called Room to Thrive. After earning a master's in occupational therapy and completing hundreds of hours of additional training, I created a step-by-step guide to help you truly thrive with rheumatic disease. This is the only program I know of that's designed to improve quality of life for people living with inflammatory, autoimmune forms of arthritis, like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, non-radiographic axial spondyloarthritis, Sjogren's disease, and more. During the self-paced lessons, you'll learn how to manage pain and fatigue, cope with stress, navigate relationships, and continue doing the things that matter to you and bring you joy. The goal is really to help you improve your quality of life and learn how to thrive with your rheumatic disease right now, rather than waiting for a distant day when it might be cured or healed. I really created the down-to-earth, practical, heartfelt resource I wish I had had when I was first diagnosed at age 20. If you want even more in-depth support, you can join the 12-week Room to Thrive virtual support group, where you'll be surrounded by people who actually get what you're going through, people who will provide the encouragement, validation, and support that you deserve. Each group is expertly moderated, so you don't have to worry about the kind of misinformation that spreads like wildfire in the free-for-all social media groups. If you're on the fence, don't just take my word for it. Here's what Katie had to say in March 2023. I was lost and overwhelmed with my RA diagnosis. It felt overwhelming to know what to read, what to do, how to spend my energy trying to research on the internet. Room to Thrive did that for me. It's been like getting a crash course in my diagnosis along with a community who gets it. To see all the details, including the dates for the next support groups, go to the link in the show notes or bit.ly/thrive room with a capital T and capital R. You can also just email me anytime at info@myarthritislife.net. And don't delay if you're interested, because each group is capped at 16 people or less in order to make a small, intimate group atmosphere. Thanks so much for your time, and I can't wait to get started with the next groups. And I can't wait for those of you who are interested in the self-paced option to go ahead and join that at any time. Bye-bye for now.
Yeah, I think, there's maybe some truth to that. The thing about rheumatic diseases is it's really true that everybody's different in some way, how the disease behaves. For example, in rheumatoid arthritis, which joints it affects. Does it affect lots of joints or not as many joints? Everybody is a little bit different in terms of how the disease behaves in them. And sometimes a medication that works for one person won't work for another person. And I think it doesn't necessarily mean the disease is more severe, but it might just mean that it's the key part of the immune system that we need to target can be different between different people. And so if we use one medication that works on one part of the immune system and it doesn't work for someone, it might just mean that in you or in someone else, it's a different part of the immune system that's driving the disease. So unfortunately, we're not at the point where we have really good tests to tell us which medication will work 100% in one individual versus another. That's where we'd like to go. But just because you might respond to one medication and Cheryl would respond to a different medication doesn't mean your disease is more severe. It's just different, I think, is how I would conceptualize it.
Yeah, that's really helpful. There's so many different myths and stigmas. Someone asked me once, well, if I have to get an infusion, does that mean my case is more severe than somebody who has an oral tablet? And I never thought of that, but it's like, no, actually, that doesn't correlate necessarily, right? The method of delivery does not correlate to how severe also.
Yeah, 100%. And the other thing I'll add is when you take a medication, whether it's a pill or an injection, there's a whole complex pathway that needs to happen for that medication to work on the arthritis, and people can metabolize medications differently. We know that it's not as simple as, measuring your blood tests and picking the right medication, because the medications, how your body processes the medications and metabolizes it, can vary a lot from individual to individual.
Yeah, that makes a lot of sense. This one's maybe really quick, but what would you say to somebody who says taking medications means that you failed to manage the disease naturally and it's a sign of weakness?
Yeah, I think with autoimmune diseases, people didn't do anything to get these, right? And the vast majority of people are otherwise healthy, and they're not doing, none of their lifestyle choices are causing them to get these diseases. There's a big genetic component, there's a big bad luck component that these diseases start. So, you know, there's nothing you can do to, you know, will away the disease, or to, yes, you can, employ healthy behaviors, not smoking. We know that smoking is actually one of the risk factors for rheumatoid arthritis, some of the other rheumatic diseases. But it's not a flaw in a person for getting these diseases. And similarly, we know that once the conditions start, the vast majority of people need medications to control them. And the other thing I think is really important to keep in mind is, the earlier we start medications, the earlier you take medications, the better the outcomes are long term. And even for people who, for some conditions, we can sometimes get people into drug-free remission. So where you're off medication, even if it's for a period of time, and your disease is controlled, the best chance you have to get to that is to actually get the disease under control quickly. So that's always I try to counter with, nobody wants to take a medication, right? If we had a choice, but it's that risk benefit. We want the medications to control the disease. We want to control the disease as quickly as we can and as completely as we can. And that's the best chance to, you know, keeping you healthy, the best chance of getting into remission, staying into remission long term.
I think that is a very important message that you just brought up and really ties into our next topic, which is two very important misconceptions to correct. First, what would you say to somebody who says medications just make you sicker?
Yeah, I think that gets back to the issue that autoimmune diseases are making you sick, right? Almost universally, people have fatigue. If it's affecting the joints, there's pain. The joints aren't functioning as they were. The inflammation is, going throughout the body. With different diseases, they can affect the organs, like, lupus, other types of autoimmune diseases. So that's what we're trying to control. And medications is the tool that we have, strong evidence for, that works well, and to control the disease from making you sick. And again, getting back to the medications, yes, medications can have side effects, but in the vast, vast majority of people, we can see through monitoring and through working with people to adjust the medications, find a medication that you're not getting side effects from, and that's controlling the disease. So it's
That's
really it's all about the risk benefit. Cheryl, you mentioned it in the introduction, weighing the benefits of treatment versus the risks of treatment.
Yeah, I think that's so important. I don't know whether you've ever heard this phrase, but Dr. Christine Stamatos, who's a new nurse practitioner, she used to be the president of the Association of Rheumatology Professionals in the US. She says, when my patients are medication hesitant, I just tell them it's like dating, it's not a marriage or it's not a tattoo. And I think that was such a refreshing perspective. Like for me, at least, I didn't even know people were so scared to take methotrexate till I made an educational patient video about how to inject methotrexate. And I'm like, I'm so helpful. And everyone's like, wait, aren't you like throwing up and like feeling horrible because you take methotrexate? I'm like, no, I've been taking this for 10 years. it works. And they're like, anyway, so long story short, it's you don't know until you try. So I think that's a good perspective.
That's exact. Honestly, I have the same conversations for people who are really hesitant to start a medication. The other thing is you can always stop it,
Yeah.
right? Like if you really, the only way you're going to know, the nice thing about our medications actually, as opposed to say, a medication you take for high cholesterol, where you never feel any better from the medication, you will know whether the benefits of the medication are worth it for you after you take it.
Yeah. Yeah.
So so that's really, and the vast majority of time it is. And so that's exactly right. That's what I always say as well is you can always stop the medication, you know, if it's not working, if you are having side effects from it. And you'll be able to tell after you take the medication, for 3 months, say, whether it's working or not. Yeah.
That's definitely true, and it is a shared decision between the patient and the rheumatologist and how the patient wants to treat the rheumatic disease too. They're not just told, "Here's a medication, you have to take it," and they're only given one option. There are options. The process of having to wait for them to see if they're the one that works for you, granted they don't have immediate side effects that need to be stopped, it can be a daunting experience, but when you do find that medication that works without those minimal side effects, like in Cheryl's case, methotrexate, it's really rewarding. But I also do want to bring up me and Cheryl are by absolutely no means sponsored by pharma
Yeah.
companies. We are patients who walk and talk the real life world of having to navigate the many different medications for rheumatic diseases and understand that untreated rheumatoid arthritis can be very devastating.
Yeah,
Um,
and I'll
and
just
me as well.
as
So
well.
just to put that
That's
out there.
and I will also say that I've been on methotrexate plus a biologic for 22 years. So my disease is also on the more severe side that requires both, like a biologic plus methotrexate. So I don't want to, and I'm on my fifth biologic in 22 years. So similar to Eileen, I have had the ups and downs of like, one medicine works really, really well for a number of years, and then my immune system's like, wait a minute, I'm gonna thwart you, and then I have to pivot.
And I think sometimes it can be frustrating because there's so many options and we don't know which one is going to work for you. There can be a bit of that trial and error. I mean, the counter to that is, Eileen, you mentioned, I forget, some relative was on gold shots back in the day. The counter to that is we have many options now for most of our diseases. We have so many more treatments. So we can almost always find something that's going to work for someone without, troublesome side effects where they take it without having too many negative adverse events from the medication.
that is such an important topic to bring up and also really highlights that we need precision medicine, which hopefully comes out in our lifetime. All right. So, yeah, we're going to wrap up this very interesting and extremely important episode with one takeaway that you would like a listener to take away from this episode.
I think I think it's being having knowledge about the risks of not treating when you're thinking about what medications to take. And I think that's one. Sometimes there can be a lot of focus on, oh, this medication has this side effect listed. That means I'm going to get this side effect of the medication without trying to consider that, it is all about the risk benefit balance. And we have, many years of research and many studies from many different countries on these medications, very comfortable using them. They're very safe. We have lots of options. So, when you're trying to make that decision of what treatment to take and whether to start treatment, really factor in the harmful effects that disease is having on your body when you're making those decisions.
Yeah, that's so helpful. Something that Dr. Frankel, Linnea Frankel, told me once too, that I thought was very convincing, is that these medications are so safe and effective that it's actually unethical to run an unmedicated control group in a clinical trial, at least in the US. You can't have an unmedicated control group because you'd be denying people a treatment that would slow down a progressive disease. Is that the same in Canada?
100%. Yeah,
Yeah.
that's a really good point.
And usually, yeah, human subjects review boards are very conservative, so they're not going to say that unless it's extremely safe, right?
Yes. And
Yeah.
it's always better to start treatment early.
Hmm.
Even if you're hesitant about medications, to take the medication early, because there's really that early window of opportunity where you have the best chance to prevent long-term complications. And then when things are going well, work with your rheumatologist to see to see if you can reduce down your medication to the minimal amount you need to keep things controlled.
So helpful. Well, thank you so much. If people want to connect with you or learn more, maybe about your research, I know you're not a lot on social media, but where can people connect with you?
Yeah, I can be Googled Arthritis Research Canada. If you go to that website, I can't remember the exact link, but Eileen would know it as well. You can go to that and connect to me through there, through email, and I'm happy to answer questions.
Thank you.
Excellent. It's arthritisresearch.ca, by the way. Yeah, great website, and you can find so much about all the amazing researchers and research going on at Arthritis Research Canada at that link. Now, thank you so much for being here today, and thank you all for listening to another episode of Rumor Has It. Join us next time as we bust another myth or highlight another stigma or a misconception.
Thanks so much. Bye bye for
Thank you so
now.
much.
Thanks
Thanks.
all.
Bye.
Thank you so much for listening. This podcast is supported by Room to Thrive, an educational program I created to help empower you to live life to the fullest with rheumatic disease. In the program, you're going to learn evidence-based tools for managing all the ways rheumatic disease affects your life. And my goal is to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded modules on your own in the self-paced course, or you can take the course along with a robust support group of new arthritis friends to support you and cheerlead you along the way. Learn more in the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I'd be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also want to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on the Arthritis Life website, plus full episode videos on the Arthritis Life YouTube channel. If you have any ideas for content for future episodes, or you want to share your story on the podcast, please send me, Cheryl, an email at info@myarthritislife.net. I can't wait to hear from you, and thanks so much again for your time.